to find out just what happened to our children since this pandemic. We're going to talk about what's normal. When children have had these kinds of experiences, what's normal? And then we're going to talk about how do we prevent them having serious mental health conditions. Then we're going to talk about what are those serious conditions? How will we recognize them? What should we do if we see them? And what implications do we have for the future? So, what do we know about this experience of COVID-19? Well, pretty much none of us have lived through anything like this. The closest we can recall is the H1N1 or the swine flu pandemic in 2009 to 2010. And that affected persons primarily in the United States, Mexico, Canada. Canada was an epicenter. And then we had the Ebola epidemic in 2014 to 2016. Those of us in the Caribbean region, we prepared for it, but we were very happy that we didn't actually have to deal with it. We did have to deal with the Zika epidemic, but that was nothing like what we are seeing today. But to be real, pandemics have been present throughout our human lifetime. Now, a pandemic is a type of disaster, but it is a disaster that has health implications. Both disasters and pandemics are unpredictable. You all understand what that means for sure. They have a community impact, they have fatalities, and they have persistent effects. But one difference between pandemics and disasters is that when we respond to disasters, we often bring people together. So we form support groups and we get people to talk about their experiences. In pandemics, we do just the opposite. We separate people. We isolate people because it's absolutely necessary. So that's a huge difference between a disaster and a pandemic. Now let's see what has happened to a child. What was happening to children as we were going through this timeline in Jamaica? Well, on Wednesday, March 11th, WHO declared the pandemic. Maybe children weren't paying too much attention to that, but certainly on Thursday, March 12th, when the first COVID-19 case happened in Jamaica, even if children weren't paying immediate attention to that on the news, their parents certainly were. Their parents got anxious. I'm sure all of us can remember where we were when that first case was identified. So children would have seen that anxiety. Then almost immediately, the closure of school was announced on Thursday, and it happened the next day. So children were just thrown into turmoil immediately. Then, shortly after that, they heard that people in certain communities were being locked away, and they wondered whether their community was going to be next. Then, other changes started happening. Within a few days, their parents were home. They couldn't go out. They couldn't go out to any places of entertainment. And then, just as they were trying to adjust to that, somebody died. And the fact that someone died made children think that anyone close to them could also die. And then our borders closed. I want you to think of how those changes happened. They happened for us as adults, but they also happened for children. Then something else happened within a few days. Nighttime curfew started. Then by April 9th, wearing of masks for the vulnerable was recommended. Okay, some children thought this was cool for a while, but by April 21st, when you had to wear it all the time, it probably wasn't so cool for children. And then as they settled in with that, they heard that a child died, April 23rd. The fact that a child died meant that they could die. And that created another level of anxiety for them. So if we think of how quickly things happened for children, we can understand the feelings that they have. So in rapid succession, they had the anxiety of persons around them. They had almost constant information from the news and the media, daily counts. They had disruption in their normal school life. They had disruption in their normal home life. They had disruption in their social life. They were away from their peers. They were isolated. There was anxiety as adults became ill and died, and there was worsening anxiety as a child died. That was a lot for our children. And then we also have to think of children who were in special circumstances. We had children who had COVID-19. You heard about some of that just before this talk. Then there were children who had ill friends and relatives. There were children who lost friends and relatives. There were children who were living in quarantine communities. And there were children who were scared when their parents went to work every day because they were frontline workers. Separate and apart from the COVID-19 related special circumstances, there were children with chronic illnesses who typically went to hospital frequently. They had concerns. There were children with disabilities who have special needs. They had concerns. And there were children in poverty who also had concerns about how they would manage. Well, what's typical? Once our children get exposed to these stresses, what's typical? Some children respond by having behavioral changes. So they get moody, they get irritable, they get a little bit more aggressive, and some get a little bit more clingy. When parents are going out to work, they may be hanging on to them more. You know, when they're asked to do a chore, they may be a little more upset. Some of them respond by withdrawing a little bit from their family or their friends. They may have more arguments with their brothers and sisters or other persons in the home. Some parents may see their activity levels increase. They become hyperactive. Some may see their activity levels decrease. Some of them just want to sleep all day. There may be difficulty concentrating, especially with parents trying to get them to do schoolwork. You might find it difficult to have them concentrate. Some of them are so active, they find it difficult to rest or relax. Some children change their eating habits. Some eat too much, some eat too little. Some change their sleep patterns. Some sleep too much, some sleep too little. There may be change in bowel or bladder habits, especially in the younger children. Children who are under stress may start bedwetting when they had stopped bedwetting some time ago. Children may seem more fearful. They may be afraid of the dark. They may be afraid of being alone. They may be afraid of strangers. Children may also develop some nervous habits, such as nail biting or rocking, lots of different habits. So these are things that common responses that children may have to stress. And most times, we can help children through these by just being understanding. But how can we make sure that we can try to prevent these disorders getting more severe than just what we consider typical okay changes in behavior? First, it's important for parents to look after their physical and mental health. You've heard a lot about first responder. You are the first responder in your home. You have to be healthy to help your child. And your mental health needs to be good because children will pick up on your fears and your anxieties. The second important preventive measure is to encourage routines. Children, like adults, prefer when life is predictable. You have a job, you get up every morning, you dress, you go to work, you come home, you relax. We all like when life is predictable. For children, the typical school routine is no longer present. Life is no longer predictable. Even when your home was chaotic, when children went to school, school was very predictable. School had a particular schedule. So what has to happen now is that you have to develop new family routines that work. And your routine may be different from somebody else's, but you have to do what works for you. It's important that you discuss and share those routines with your child. In fact, ask your child to help you develop the routine. And for children who can't read, you can use pictures to show the routines for them. You can have a picture of your child getting out of bed, then a child having breakfast, then a child settling down to do some schoolwork. And you just point to the routines, point to each picture as you're changing routines. Encourage your children to speak or otherwise express how they're feeling. They could express how they're feeling by drawing, by acting, by playing. But you need to truly listen and participate. washing the dishes and just giving an occasional eye is not truly listening and participating. It's important when children are stressed and stressed for long periods like this pandemic that you really listen. And it's also important to share your own feelings with them. When children understand that you have a little concern too, and hear how you're addressing your concern, they will learn that it's okay for their feelings, but it's also okay to find a solution. Give extra hugs, extra kisses, and extra praise. Children who are stressed need this. Find ways for your children to keep in touch with family members and peers. We physically distance, we can be socially close. Reduce exposure to media and the screens. Now, I know a lot of media is being used because a lot of schoolwork is being done like that. What I'm talking about, though, is frequent reports on the pandemic. Children can't often put them in context, and it can be very scary. Keep children engaged in activities, but also remember that just like you, downtime and free time is important. Ensure a healthy diet, rest, and physical exercise. Now, what have we learned about the more serious illnesses? Well, when they did parent surveys following the H1N1 in North America and in Mexico, they found that there was post-traumatic stress disorder in almost 1 out of every 3 children who had been isolated or quarantined. They also found that that happened for 25% of parents. So both parents and children had some difficulties with isolation and quarantine. And it was also found, remember I said to look after yourself, because it was also found that where adults had PTSD, the children were more likely to have PTSD. When the children who had received mental health services were looked at, they also were found to have generalized anxiety disorder. They worried about things that they shouldn't worry about, everyday things. They were fearful of everyday things. They also had adjustment disorders. An adjustment disorder is an unusually intense or prolonged response to a stressful event. We all have responses to stressful events, but an adjustment disorder is when it's very intense or very prolonged. And when they looked at the children who actually got mental health services, they actually only found the post-traumatic stress disorder in just over 1%. But as I showed you earlier, when we looked at all children and adults, even those who did not receive mental health services, we found that more children and adults had post-traumatic stress disorder. In Wuhan, in China, they found that almost 1 in 5 children were depressed after they had been in lockdown for a week. Depression may present with severe withdrawal and severe withdrawal of eating and inability to sleep. They also had children who had anxiety. This was after 30 days of lockdown. So we've talked about some of the more serious mental health conditions that can occur, but before that, we talked about how to prevent those. Now we want to address when should you seek help for your child. If your child's behavior is very different from what you're accustomed to, you should seek help. If your child's new behavior is continuing for a long time and it doesn't seem to respond to your attempts to help, you should seek help. Really what I'm saying is that if you are seriously concerned about your child, it's always best to seek help. And where should you seek help? The Ministry of Education, Youth and Information has established a number of parenting hotlines. Some of them are on the screen, but there are others in all parishes. Please check. There are, I think, some 36 different lines that you can call. So that's somewhere that you can just stay in the comfort of your home and get some help from. Other places that you can seek help is your nearest healthcare provider, whether that be your well child clinic, your family doctor, or your pediatrician. You can also seek help from your church counselor, from your child's teacher or guidance counselor. Many of you are in touch with your teachers and guidance counselors, even in this pandemic. But seek help from a professional who can provide you with the right guidance. However, as we look forward, there are long-term implications for this in that some children may have conditions that don't get identified until much later on. It will therefore be important at a policy level, at a government level, and at training institutional levels that we train our teachers, our healthcare workers, our pastors, and others to identify children and families suffering from trauma, to provide them with first contact support, and to be able to refer them on if we think they need further help. Thank you for listening. I hope this has helped you to understand a little bit how children experience mental health challenges and how you can help your children in your own home. Thank you.